Hello, this presentation is about the pathogen chlamydia. So the classification of chlamydia, and I have a little picture up here in the upper left showing the gram stain, but chlamydia is a genus of bacteria in the family Chlamydaceae, phylum Chlamydae, and Chlamydioles, which consist of obligate intracellular pathogens such as C. trachomatis, C. pneumoniae, and C. cetaceae. These organisms are gram-negative, and they appear coccoid or rod-shaped, and unlike most bacteria, they contain very little detectable peptoglycan in their cell walls. They are non-motile and cannot reproduce outside of host cells, making them metabolically dependent on their intracellular environment rather than free-living aerobic or anaerobic growth. Their virulence is tied to their unique developmental cycle, which alternates between elementary bodies, which are small, rigid, and infectious, and reticulate bodies, which are larger, metabolically active, and replicate within host vacuoles. Additional virulence factors include the major outer membrane protein, which aids in immune recognition and identification, as well as their ability to evade host defenses by minimizing peptoglycan and persisting within intracellular inclusions. So on the right, over here at the top, we have the female and the male diagram, which shows where chlamydia affects the body. So for the pathology, chlamydia primarily infects the urogenital tract, which targets the cells that line the cervix, the urethra, the rectum, and the throat. In some cases, the infection can spread to the eyes, causing conjunctivitis. The bacteria invade host cells and multiply within inclusions, leading to tissue damage, inflammation, and scarring. Over time, untreated infections can result in serious complications, including pelvic inflammatory disease in women, infertility, and chronic pelvic pain. In men, it may cause urethritis, epididymitis, and prostatitis. So this slide is about the signs and symptoms of chlamydia, and in the bottom left-hand corner, I have a little photo showing some of what those symptoms might be. But chlamydia is often called a silent infection because the majority of the cases are asymptomatic, meaning that you might not experience any symptoms at all. When symptoms do occur, however, they vary depending on the site of the infection. So in women, signs may include abnormal vaginal discharge, burning with urination, bleeding between periods, or pelvic pain. In men, symptoms may include penile discharge, pain or burning during urination, and testicular pain or swelling. Rectal infections can cause pain, discharge, or bleeding, while eye infections may cause redness, swelling, and discharge. Because many infections go unnoticed, individuals may unknowingly transmit the bacteria to their sexual partners. So in the left side of the screen, I have a little photo showing how chlamydia can be transferred from either male to female or female to male, and then the different areas that it can affect on the body and like how that all works. So you can just follow the little diagram. But chlamydia is not spread by vehicles, carriers, or insect vectors. Prevention does include condom use, regular screening, partner treatment, and prenatal testing to reduce transmission. Chlamydia is transferred through sexual contact involving vaginal, anal, or oral sex, as well as sharing sex toys. Less commonly, transmission can occur through infected fluids contacting the eye. Pregnant women can also pass the infection to their newborn babies during delivery, which can lead to conjunctivitis or pneumonia to the infant. The incubation period for chlamydia, which is the time between exposure and the appearance of symptoms, is typically from 1 to 3 weeks. However, so many cases are asymptomatic that individuals may not realize they're infected during this period, which allows the bacteria to spread within communities. So in the right-hand corner up here, we have a photo from 2001, which was provided by the World Health Organization, showing the estimated amount of cases in different parts of the world. Chlamydia is one of the most common sexually transmitted infections worldwide, which is caused by Chlamydia trachomatis. And in 2020, the World Health Organization estimated 128.5 million new infections among adults aged 15 to 49 years old. The global prevalence was around 4% among women and 2.5% among men. Because many infections are asymptomatic, the true number of cases is probably even higher than that, which makes chlamydia a major health concern. Chlamydia disproportionately affects young people. More than half of all reported cases occur in adolescents and young adults aged 15 to 24 years old. Women in this age group are at a particular risk due to both biological and social factors. Higher infection rates are also seen among men who have sex with men, especially with strains that cause lymphogranuloma venereum. Additionally, pregnant women are an important group because untreated infections can cause premature birth, low birth weight, and transmission to the newborn. So there are therapy and tests that can be done for chlamydia. The main treatment is doxycycline, which is an antibiotic. And then there are two alternatives, and I might be saying these wrong, but they are azithromycin and levofloxacin. These antibiotics work by inhibiting bacterial protein synthesis, which helps to stop the replication of Chlamydia trachomatis. Doxycycline is more effective than azithromycin, especially for rectal and oropharyngeal infections. Prompt treatment prevents complications such as pelvic inflammatory disease, infertility, and ectopic pregnancy, and also stops the transmission to partners and newborn babies. There are no vaccines currently available to prevent chlamydia. Infection does not provide lasting immunity. Reinfections are super common, especially if such sex partners are untreated. And I think a big part of this too is that chlamydia can be asymptomatic for a lot of people, and so it can spread. And you may be reinfected without even knowing. And so partner treatment and follow-up testing is super important. The most common method to diagnose Chlamydia trachomatis is nucleic acid amplification testing, which is performed on urine samples or swabs, and those could be vaginal, cervical, urethral, rectal, or throat. Nucleic acid amplification tests are highly sensitive and specific, making them the best option for chlamydia testing. Some new data that I found was from a 2023 review in the Frontiers in Cellular and Infection Microbiology, which highlighted that chlamydia harbors a conserved 7.5 kilobyte virulence plasmid encoding multiple proteins that plays crucial roles in infectivity and the induction of inflammation. In particular, they are essential for robust infection and tissue invasion, as strains lacking these proteins show reduced infectivity and are cleared more rapidly in animal models. These findings underscore that the plasmid's multifaceted role in virulence and suggest that targeting these plasmid-encoded pathways could be a promising direction to developing future therapies aimed at preventing persistent or severe chlamydial infections. And this is my works cited.